My clock just hit 1, so we are going to get started. Welcome to the new normal in the workplace that is being co-hosted by the Quinlan School of Business and the Parkinson School of Health Sciences and Public Health as part of our Beyond Crisis Management Preparing for What's Next series. And I have to just start by saying, having been in this series for just over a year, I am so thrilled that we are looking to the new normal and we are talking about what it looks like to come out of this challenging time rather than just how to mitigate the challenges in this time. So for those of us who have been on this journey, and I see many friendly faces, it is wonderful, even though it is still difficult, to now be talking about what this means as we look forward. We are going to start, as we often do, with a welcome and strategic overview from Elaine Murado, who's the founding dean of the Parkinson School and who has been such a godsend for our university over this last year and several months as we've tried to understand these issues. She has been our own Dr. Fauci here on campus. We have 2 Loyola experts from our business school who are then going to take a look at what this means for the workplace. Arup Varma, our distinguished university research professor, and Colleen Reaney, who directs our Executive and Professional Education Center. And then we are going to look at what this means in practice with a leader who is working with corporations across our country to bring mental health to the workplace, Laura Sage, who is the CEO of Chill Anywhere. And so with that, let me, and that's me, a little bit late in introduction. I'm Seth, I lead the Baumhart Center here at Loyola. But the person I was expecting to pop up was the person you now see. And let me turn it over, Dean Murado, to you to allow you to open up this discussion and give us context.
Thank you very much, Seth. And I'm really delighted that we are at this point of discussion. And as I was preparing my slides, I will humor us a little bit with some reflection on the journey we've been together collectively. If next slide. Yes, so almost a year ago to the date, when we first started convening this, Seth and I really wanted to make sure that we were bringing the best public health knowledge to our community and those that are in various forms of the workplace. And I think in retrospect, as we look back, here was May 19th, a year ago, this was a COVID roadmap to recovery that was put forth by Scott Gottlieb, former commissioner of the FDA, and really thinking about it as a phased journey from slowing the spread, reopening, establishing protection and immunity through vaccination, and at a stage of lifting restrictions. And that's where we are today. Next slide. And so what we've tried to do is recognizing that how do we bring knowledge to bear to all of you that are in the workplace trying to implement on the ground best practices along the way. And some themes that you'll hear today, and I think have been really foundational, is the need that we're all in this together, that our success is really dependent as a society and as a community, and our resilience economically is cross-sectoral partnerships. And we talked about that as we considered how we reopen and testing and contact tracing, policies and HR procedures, and bringing people back safely. Ways that folks have been innovating in community to meet and reach underserved communities of color, and then thinking of our own wellness, and we'll be able to continue on that more today, and recognizing that this has been a draining slog affecting many of us, not a sprint, but a marathon. But we're seeing hope in terms of the vaccines coming here in the US and rapid implementation and discussion around how do we build trust on vaccines. So where we are today is in a very fortunate place that we're able to have this conversation around a lifting of restrictions and seeing a way out of this path together as we rebuild our capacity going forward. Next. So at this stage, I like to always reflect on what are the public health numbers right now. This here I pulled yesterday, and it's looking at Illinois state statistics, both on the reported cases at the top, and then you can see where things are right now in terms of 14-day change. These are the metrics that our public health and political leaders have been tracking. But just take a pause here. I mean, even the last few months, the number of cases that were occurring here in Illinois we're higher than where we were when we started on this journey together. And look at the tremendous surge that we all endured together around the holiday time. It's certainly notable, and it has hit many of us in very different ways. Next, please. The good news that we can be looking forward is the miracle scientifically of having vaccines ready within less than a year of the pandemic really starting. Here are statistics around where we stand in Illinois. These numbers here are very similar to national averages. These numbers, coupled with what we're seeing in the epidemiologic metrics, is why our politicians here, our governor in Illinois, and our mayor are looking forward to reopening June and July, and really already allowing residents that are fully vaccinated, not necessarily needing to wear masks and so forth. So we're on a precipice of reopening and of hope. Next, please. We hear in the news about this concept of herd immunity. Herd immunity is really a concept that is dependent upon how much we're interacting with one another and what close proximity. It has to do with the characteristics of the particular virus itself and how easy it is to spread. And the virus itself is adapting. That's why you hear in the news about different virulent strains and so forth. But in estimate, if you listen to the national leaders, if we can get to that 75% or so of people fully vaccinated, we know that that's at a rate we probably can be really squashing it. And our national leaders here, this is a graph from the CDC, have really been tracking progress and trying to expand accessibility of vaccines. You're hearing in the news great news about both Pfizer and Moderna having data showing effectiveness and safety in adolescents, 13 and older, and continued work around younger children. The light gray lines here are showing various projections over time and trying to say, how quickly can we get to that herd immunity level? And here's what you're seeing on a national scale, might be around August that we're getting at that number, which would be fantastic. And really, given the size of our country and the complexity, quite a feat when you compare how the immunization has been going on around the world. Next, please. So that brings us here. Lots of optimism. We can see a path out, and we have a sense of encouragement. And so what can we expect in this new normal of the workplace as we now transition to a more open work environment? Next. And I think it's important to reflect that answer to that question depends on who you are and what setting and context you've been operating in. We have to acknowledge that our friends and colleagues, that COVID has affected some more disproportionately than others. We see this in the headlines here in Chicago. Here I pull out an initiative that's actually looking at this as a racial data tracker nationally. This is out of Boston University. But we know that COVID's affected Black, Indigenous, Latinx, and other peoples disproportionately and the most, whether that be cases, whether that be mortality, or whether that be vaccine access itself. Next, please. But it also depends on what kind of work you're doing and what kind of workplace in which you're operating. And depending on that setting, we know that certain workers have been disproportionately affected in terms of the burden of managing through this pandemic, as well as the emotional strains and stresses. And here are 3 headlines that I pulled from this week. Stress on the front lines for our healthcare workers, nurses at breaking points and quitting the profession. We see the same thing in terms of other essential workers, frontline workers at grocery stores, other convenience stores, public transportation, literally in tears on days in which they're going to work. And we hear it also from teachers who they themselves also feel a need to be nurtured as they've been trying to work through reopening and meeting the teaching needs of children face to face. Next, please. But it also depends on us. Many of us have been working and been fortunate to be able to work in safe environments. We've had technologies that we can work at a distance. We work in a traditional kind of office. And this here is some high-level data that came out of Steelcase, a global report that they looked at various countries and norms. So for those of you that might be operating in a global spectrum of work, I suggest that you look that over. I just pulled out here the US data. For us in those kinds of remote work settings, there have been benefits. There have actually been silver linings. No commute, a time to actually, for some of us, be able to do exercise before or after work. For some of us, an ability to focus and be productive, not distracted with people bopping into your office. But there have been challenges, a sense of isolation. We are humans, we are social, and it's lonely. And while we may have had early productivity gains over time, it becomes difficult to do team collaborative activity completely from a virtual environment. And that impacts the speed of decisions and how we move innovation forward. I put here, they offered up five different personas. You can see which one resonates most with you. But we have a variety, even in a common workplace setting. Each of us have been adapting to this depending upon our home need and situation. So on the right is what Steelcase is expecting, and I've seen these numbers from other reports as well. The new normal for the office setting is folks have expectations of a hybrid. They want to keep some of these benefits that we've enjoyed. They recognize that we need to be in person, but they're looking for flexibility. And this makes it particularly challenging as we start to think about new policies and scaling and sustaining those policies beyond the emergency response of the pandemic. Next slide. I just want to say, not to be doom and gloom, but also the pandemic is not over. So while our local environment is looking extremely encouraging, the threat of COVID declines, our risk perceptions are also seeing good news. This is still a pandemic. And in the US, these are data from Mayo, you can see that there's variation in vaccination rates in pockets in the United States. You see it in different regions of the country, whether they're at least one dose or fully vaccinated. You also are starting to see variation whether or not you live in a city or a rural environment, which tends to be less vaccinated right now. What does that mean? That means that the COVID is still circulating and there might be areas that might become hotspots. And so we still need to be vigilant and nimble and pay attention to all of those pandemic metrics, even though we're very burnt out by it. And so many of us leaders have got to be wearing the encouraging as well as also being pragmatic and still being on our toes so that we can be responsive if change occurs. The next slide just reminds us that we in the US operate in a global world, and we've seen tremendous pain and affect many of you, perhaps a family that you may have in India, but virus variants are still occurring around the world. It's still circulating, and not all countries have benefited from the vaccine implementation that we have in the US. So until that is all settled down, we are still all in this together. So last slide, I'll stop talking and turn over to our experts so they can help lead us through how do we prepare our workplaces for this new normal as we see the COVID gradually decline, particularly in our local environments. How do we support the teams as they emerge from the trauma of living through this pandemic? And how do we be pragmatic and new expectations for workplace flexibility and support so that we can attract and retain the best talent in our workplaces? So I'm going to stop here and turn over to our experts now, Seth.
Well, thank you so much, Dean Murado. And you are certainly one of our experts, especially when it comes to public health. So we're very grateful for the strategic context that you've shared. And one of the observations you made is that this disease has not impacted us at an equitable level. It has followed the systemic inequities that preceded it and has been built upon it. And so in that context, one of the keys to building the new normal in the workplace is to have diversity, equity, and inclusion at the core. And one of the leaders of that, both on the SALT level as well as a role model himself, is Arup Varma. And so let me turn it over to you, Dr. Varma, so that you can walk us through how to think about those issues as we enter this new normal.
Thank you, Seth. And I think we'll just leave this slide up. We don't need to change slides. I think this one was best. No, thank you again. Next slide, please. So I'm going to talk about the new normal, which we really don't know what it's going to be. It's going to be different for everyone. So it's not like it'll be a new normal for all of us. It'll be a new abnormal for some, new normal for some. So it's going to be very different. But I want to take this in reference to DEI, diversity, equity, and inclusion. 1 year and 1 day after George Floyd was murdered, we are here today. Let's not forget that most of us have not been able to talk face to face with our colleagues about that. So when we get back to work, many of us are going to want to talk about it. And others are going to say, forget about it, it was over a year ago, but that's not going to work. Next slide, please. So I got this from the Clorox company. And because we often ask, is diversity, equity, and inclusion just about race, just about gender? Of course, those are the two main factors, but there's a whole bunch of factors that we often ignore. So we can see it's culture, it's skills, and Dean Morato just mentioned some of you may have relatives in India. So we are in a connected world. All of that affects us. I've lost a couple of family members recently, very close, cousin and brother-in-law to COVID. So it's all of these things, plus this additional slide that I've added now of the COVID effect. How has it affected us? I had COVID last year in June. Took about a month, recovered. I've forgotten about it, but I've gone through it. That's going to be a new world. So I am very concerned. I am fully vaccinated. I don't want to be around people that are not vaccinated, whatever their political reasoning is. Because my doctor says, yes, you are fully vaccinated, but you're also old. So be careful. Next slide, please. He said that. I know I don't agree. So when people come back, we can't just offer equality, saying, okay, everybody needs to do the same thing now. We got to get it right. We got to offer equity. So if somebody needs additional space from other colleagues, we can't be like the CEO of a very well-known publication in Washington, D.C. that recently sent out this, and she's already apologized. None of that, come back, do the right thing. Everybody needs to be more reasonable. Or like our friend on the South side, Tony La Russa, was yelling at his own player and bad-mouthing him because he hit the fourth ball after 3 balls. You have to realize everybody works under a different set of circumstances. So let's be more empathic and empathetic. Next slide, please. So what is diversity and inclusion? Now we've got this new group of people with the COVID effect. It's affected all of us differently. Like Dean Morato said, we can't assume, hey, I got over it. So what? The rest of my colleagues, the rest of my co-workers may be at different stages of that. Maybe they've lost family members. There may be some who have absolutely no impact. And they're like, hey, it was a joke. It was nothing. Verda Myers, this is one of my favorite quotes, is diversity is being invited to the party. So, oh, everybody come back. Inclusion is being asked to dance. What that means is we need to ask everyone now what they need. And if some need to work from home, then they will have to continue. Many companies are doing that. They've already announced it. Well-known companies, they're being very reasonable. But not all can do that. Not all jobs can be done from home. So let's be reasonable. Next slide, please. One of my good friends, ex-students, colleagues, and I think she's here today, Tangia Coleman, and we often do this session, and we talk about this notion of intersectionality. This is something we often forget. So for example, when you say race, somebody may be a particular race, African-American, but may also be female, may also have a different sexual orientation. And now we've got this COVID effect. So nobody is one singular dimension. We all have these different factors that may be affecting us, especially as it relates to the COVID experience. Next slide, please. So what can we do? Here are some best practices. Create a sense of belonging for everyone. Even those that are staying at home, either out of their choice or medical reasons. Somehow if we're going to be good leaders, we've got to figure out everybody should feel, well, she doesn't show up, who cares? We don't need to tell her about this. No. Or he's staying at home, doesn't matter. So empathetic leadership is critical. No quotas, we don't want quotas. Okay, we'll make 2 of this group, we've covered everyone. Next slide, please. Inclusion is a process, not an event. It's not going to happen. Okay, we're all back. Welcome. Now let's get back to work. Chop. That's not going to happen. No more my way or the highway. Unfortunately, the management literature has been literally yelling for 50 years. Don't use that style. It does not work. It only works in John Wayne movies. But we haven't listened. We still have managers saying my way or the highway. And we know the results. Maximize hope, minimize fear. People shouldn't be scared. Will I lose my job? Will I have to do this? If I can't come in, even though my children need me, my parents need me, my spouse needs me. Help everyone, and I should have highlighted everyone. Survive and thrive. Everyone. Doesn't matter who they are, what their needs are. If we can't do that, we shouldn't be leaders. We're not leaders. We might have the manager title. I'm not a leader. Next slide, please. Thank you very much. And because I think for a long time yet, we are not going to be shaking hands. So namaste.
Namaste. Thank you, Arup. And let me just add my sorrow at the loss that you experienced recently.
Right.
We are going to move into a conversation with Colleen Rini, who is the Director of Executive and Professional Education. Dr. Varma has given us some really powerful concepts to think about in terms of how we build an inclusive workplace. And Colleen has been at the front lines working with a lot of companies as they actually build out customized practices to try to embody the principles that Dr. Varma just described. And so, Colleen, let me start with you with an open-ended question. How do you see workplaces that you're working with approaching this new normal?
Thank you so much for having me.
Perfect, we hear you now.
Yep, thank you so much for having me. Yes, we have been for the last year talking with different companies and organizations. Many of them really wanted us to have a conversation with them of, we've shut down our office now. How do we manage people remotely that we have never done before? And so we did a lot of conversations with them about transferring files to a cloud service and really just trying to put timelines and schedules together. And now it's a conversation of how are we going to reopen and bring people back into the workforce? And my first question to them always is, do you need to? Is there a business purpose that you need to bring people back together? Knowing we are still in the middle of a pandemic, we are getting through, but we are still wanting to lead with caution first. I'm very much a person who asks permission first, not forgiveness later. So that's the way we've been leading some of these conversations in our spaces. And many of the organizations that we're working with are starting to do position audit reviews where they are looking at positions that they have within the organization. If both of them are customer service representatives, what are the unique factors that that individual has, and what else is within their frame of reference or within their scope of work in office and personal life that may make it challenging for them to return to the workforce. The number one concern, as was alluded to earlier in the slides, is the childcare and caregivers. And as many companies are asking people to come back June 1st, everybody come back June 1st. That's just the grand storm of when all these children are out of school or at least out of places. And some park districts have not reopened yet for their daycare centers. And some senior homes have not opened yet as well for open spaces. So there is this equitable to try and figure out what are individuals doing, what are their particular challenges that they may face returning back to work, and what could we do to make sure that both of those people have equal opportunity to do the position that they want where they want to do it.
And so, Colleen, you saw in Dean Murado and Dr. Varma's remarks that there is this need for hybridity for so many workers to accommodate them and to also make sure that it's really a thriving place. And many people from a personality and thriving perspective really want some of that time now at home and have come to expect it. We've just spent 15 months where that has been obviously the norm, except in essential industries. You've been working alongside a lot of these companies. What are some of your tips about what we've learned over the last 15 months about how you manage people successfully who are working at least part of their time remotely?
Absolutely. It's a lot of conversation, first and foremost, with leading with empathy, looking through the lens of that worker and how are they being successful in the job that they're being right now to manage them remotely. The second thing is asking them what they need from you as a manager to be successful. Many a times we don't have those conversations. When I hire somebody new at our team, I'll ask them how they would like to be communicated with. Are they a face-to-face, a telephone, a technology communicator? So that way you know their communication style that works most effectively with them. If you do have more people on your team, for example, that like to have more face-to-face, more meetings, more in-person conversations, they are probably itching to get back to the workforce and to get back into their offices. So just keep that in mind, excuse me, as you're managing teams. The other thing is making sure you have good resources around so people can be successful, to making sure that there is a cloud system where we can share documentation with each other, making sure that there is opportunity for the face-to-face conversations, whether it's Zoom or Teams. As you can imagine, we work with many clients, so I have about 10 different software services that we're using right now online. But just making sure that you have the technology and the resources available. And if they don't, asking the questions of your IT department as to how people can be successful at home. And then also trying to understand that, many companies have had these remote policies in place, but maybe your organization does not have a remote work policy. And what does that look like for your organization to work with your HR office to make sure that the policy is in place with some flexibility, that people can have discretion of talking to their managers when the time is needed for some of this remote work. We have seen one example of a company earlier, almost in January, that was going back to the office, and they were actually doing a color-coded system where there was going to be different zones that people would be working in. They'd be wearing red, yellow, or green buttons on them, depending on what level they were at of being had COVID, had never had COVID, have been vaccinated, have not been vaccinated. And then there's different mask zones and different policies of how many people can be in conference room spaces, or how many people could be in office spaces, how many people can use the water fountain. The amount of water fountains that are turned off across the nation right now is high. But I just want to say that you really have to look at the culture of the organization and then set those expectations for your team based on the needs that they have as well.
Great. Well, thank you, Colleen, for that sage wisdom. And that is actually a perfect segue to speak to Laura Sage, who is the CEO of Chill Anywhere. And we have now talked about the need for diversity, equity, and inclusion, the way that workplaces are adapting. Many of them have partners that they are working with. And Laura is a partner to companies across the world who are in particular thinking about the mental health and wellness of their teams. And that topic has never been more important, because in Dean Murado's literature, people said they like what this moment has presented in terms of no commute. What they miss is connection. And that has presented really profound impacts on isolation and on our mental wellness. And Laura has been working with companies to really solve for some of those issues, and more broadly to create wellness in the workplace as a must-have rather than a nice-to-have. And so, Laura, let me turn it over to you so you can share what you're up to. Oh, and you're on mute, but we are all eagerly in suspense.
Thank you, Seth. I am really honored to be here with such an esteemed group of panelists. Thank you for having me. I don't know if you'll recall this, but the first time that you asked me to speak digitally was in April of 2020, regrettably right as we had entered the pandemic. And as you noted, I am hopeful and optimistic that perhaps this opportunity to speak will also mark the end of the pandemic, or the soon to be end of the pandemic, at least for us in the United States. And again, I'm really sensitive to all the other places in the world that are not as advanced as we are. So without being insensitive to that, hopefully this is bringing good news to all of us. One silver lining that I want to discuss real quickly is that the pandemic has brought an awareness of mental wellness and a realization of the responsibility of employers to support mental wellness in a way that was maybe nascent at the beginning of the pandemic, but it has really accelerated that. And that I do consider to be one of the silver linings of this whole challenging period for us. Next slide, please. So why am I speaking to you? As Seth noted, I'm the founder and CEO of a company called Chill. Our mission is to help people live less stressed and more mindful lives. And we started as a studio, but we had been on our current trajectory well before the pandemic hit. And the roadmap was to help businesses help their constituents, usually their employees, but could also be their customers, live more mindful lives and use mindfulness techniques to help support mental wellness. What we do is we create both customized content, and we have a very large library of on-demand content to help the people that we work with. And as you've noted, we've worked with over 400 businesses, not just in Chicago, not just domestic, but worldwide. We have actually users in 90 different countries. Next slide, please. So even before the pandemic, mental wellness is something that businesses were starting to take responsibility for, and not frankly just because it improves their bottom line. As the dean mentioned before we hopped on this call, losing one employee will cost 3 times their salary to be replaced. But younger employees were demanding this from the workforce. Younger people are much more comfortable talking about their mental wellness, the mental wellness challenges that they face, and they're expecting support from their employers. I happen to run a nonprofit organization that raises money for cancer researchers. I wish that I had a tool that could be used prophylactically to prevent cancer. Particular focus for me is breast cancer, and there really isn't a tool like that. This is why I care so much about promoting mindfulness and other types of meditation. It helps with mental wellness. We can mitigate a lot of very tragic consequences as a result of mental challenges if we promote this to our communities. And I believe in it wholeheartedly. There are also a slew of other health benefits that come with practicing meditation on a regular basis and making it a habit. And those are listed on the right-hand side of this slide. So next slide, please. Great, thank you. So you could hand your community an app and you could check a box and say that you've provided a mental wellness solution. But what we've noted is that most people don't take to it. So what we're spending a lot of time doing right now is helping with adoption, adherence, doing it in an authentic way so that it may become habit and that your team, as well as you as the employer, will reap the benefits of it. So what that tends to look like is us taking a moment to listen, to ask you and your employees or your school or your hospital, what's going on? What's going on behind the scenes? How can we help you the most? And then actually providing customized live content to meet your team's needs where they need to be met at that moment. Then we support the practice in a more accessible, inexpensive way with on-demand content, and then reinforce existing lessons and possibly some more relevant content with sustained live practices. Those could be once a week, they could be once a month, they could be once a semester. But that's how you really get your teams to adopt mindfulness as a practice and ultimately reap all of the rewards that come with that. Next slide, please. So there are some themes that are based in mindfulness that seem to help almost all of the businesses that we have been working with. So for instance, there's resiliency. As Dean Morato mentioned, this is a marathon. All of us are tapped out. Communication. So there are a lot of important subjects, as Dr. Varma had mentioned, that we haven't talked about yet. We haven't been around each other yet, but they should not be swept under the carpet. They're going to need to be addressed, and they're going to need to be addressed with a level of sensitivity and empathy that we might need to cultivate. Managing stress and anxiety. I just read a study from Deloitte. There's a woman there named Jen Fisher who's very prolific in the wellness space, and she noted that 77% of us have felt burnt out in our current job at some point recently. And then emotional intelligence, that's something that's a little bit more nebulous. It's a concept that was popularized by a clinical psychologist from Harvard named Daniel Goleman. And the way he defines it is being aware and controlling and expressing our own emotions, and then the ability to handle interpersonal relationships judiciously and empathically. So I'm going to let you stew on that for a second. The next slide, please. So originally, when we created this slide, the intention was to show you how customized our curriculum has become, in particular during the pandemic. But as I was going through this and reflecting on, for instance, we work with a lot of law firms. That's a vertical that we have quite deep experience in. And one of the things that we work with law firms is on continuing education credits. Lawyers have a higher rate of substance abuse and suicide versus other professions, higher education professions. But who right now doesn't need to know more about substance abuse prevention and suicide prevention? Burnout, something we have experience within the healthcare space, but as we discussed, it's not just healthcare workers, it's teachers also. It's almost everybody is struggling with burnout right now. Diversity, equity, and inclusion, Dr. Varma talked about that, but to not just understand we need to be empathic, but to actually understand our own biases and what we might bring to the table is something that requires practice. It's not just 1 hour-long session once a year and checking a box. And this is something that we need to encourage, and we need to encourage the practice of it. And then reentry, we have these beautiful curriculum that we've created over the last year on diversity, equity, and inclusion. And the newest program is on reentry, and it's important for everybody. But I think that the most significant way to understand the impact of these practices and why they are so powerful is to actually do one. So if you would all indulge me, next slide, please, Seth. I'm going to host us in a metacognition visualization, which sounds very complicated, but in this case is going to be very, very pure and simple. So if you would all indulge me and close your eyes, we are going to have our eyes closed for less than a minute. And while your eyes are closed, if you could please visualize an apple. So get in your mind eye a perfect picture of an apple. Once you have it there, please feel free to open your eyes. So I'm going to guess that a lot of you may have visualized a red apple. As a 16-year-old that I live with mentioned, of course, everybody is going to think of a red apple. It's the emoji on my iPhone. Now I fact checked that, and actually you have a red apple and you have a green apple if you have an iPhone. But some of us probably also did think about green apples, and there might be a couple of us that had golden apples, which are yellow, right? So I mention this because it brings to light in a really benign way that we all come, thanks Carl, Carl had green, so everybody was not red, but we all come to the table with biases. And in the case of what color apple we visualized, it's pretty benign. But if you can imagine as we go back into the workplace, what biases we might bring with us that aren't quite as benign. And so with a metacognition exercise, what we're doing is we're coming to become more aware of how we personally think. And as we become more aware of how we think, it makes us more empathic and more sensitive, and it trains us to be more emotionally intelligent. And those are skills that we can bring to so many different aspects of the new normal workplace. So our last slide, please. I'm going to conclude the way that we end all of our programming, which is thank you for taking the time to chill. And if you have any questions, please feel free to reach out to me. Thank you.
Thank you, Laura, and thank you all for what have been really phenomenal presentations. And I'm going to take down our slides now, and then we can see our phenomenal panelists. So it is, I mean, really interesting to think about how this whole change is taking place, because we've gone from just in a period of months, you know, a surge that meant except if you were essential, you were at home, to a place where everyone is kind of making up the rules now as they go, and have been supercharged now by the CDC saying, you know, for those who are vaccinated, they can be even indoors without masks. And so I'm curious to ask each of you, because I see a number of workplace leaders who are on this webinar, you know, what are some of the tips that you would share with leaders about how do they begin to learn the needs of their workplace as they begin to plan for the new normal? One of the things that each of you have said is it's really important to really customize to all of the different people, all of the different positions you were describing, Colleen. How can they begin to do that? One example you gave, Colleen, was the position audit that some are engaged in. I'm curious if there are other examples of how leaders can begin to assess where their different, you know, constituencies are, so that they can then understand that as they put together their plan for the workplace itself. And this will start our popcorn style, where this can go in any order. Whoever pops first can unmute. Yeah, go for it, Laura. Get us started.
We're big believers in surveys. So it's something that we encourage at the beginning, middle, and end of any programming that we do. And by the way, you might get a different answer the second or third time you ask the exact same question. So we're big believers in surveying. It's a great way to listen. Don't survey if you're not going to listen to what your teammates have to say. That will add more, that will do the opposite to what I think your intention would be, but we're big advocates of that.
Great, thank you, Laura. Aru, and then Dean Murano.
Thank you. I just wanted to add a couple of things. I absolutely agree with Laura about the surveying. That's critical. But here, when we do the survey on this matter, we can't go by the majority. Well, 90% think this. No. The 10% who think that also matter. They might be the real ones that need to be approached. That's number one. And the other thing leaders need to do is keep updated with what's going on. So just today, Malaysia has overtaken India in terms of the number of cases per million. And it's a very densely packed country. So this thing is not gone anywhere yet. It's evolving constantly. So be aware. Don't think, oh, we know it's done. It's not done, as Dean Murado pointed out. Thank you.
Yeah, thank you. Dean Murado?
Yeah, and recognizing, depending on your workforce, they and their social family networks may be connected with these hotspots as well, right? And if you're in a global setting, work setting, you know, you may have work colleagues that are also situated in different parts of the world. I'd be curious, Laura, if you have any like templated questions that you might share with us, but because I think how we can learn and build off of already established good questions to ask is always helpful too. I wanted to add, I think staying attuned. You know, like we talk about it in like behavioral care, being attuned when you're in one-on-one, approaching even in a virtual environment. Are you attuned to sort of signs and symptoms? Like, for instance, I had a work meeting. Everyone had normally been always very collaborative, and I had a whole 2 hours in which everyone, you could just tell from the screen, was like dead zombied, right? And I have to pay attention to that, right? And not get angry or frustrated and say, no, that's a sign and symptom I need to pause and think about, right? Oh, there's an idea. This group's thinking about doing picnics over the summer. That's a sign that they are trying to figure out ways to connect. How do I, as a leader, help them and enable that? How do we take that idea and spread it to other parts, right? And I try to this year do these sort of cups of coffee kinds of settings. You know, how can I as a leader try to replicate the just walking around? You know, in a small work setting, this is easier to do than if you're obviously on global scale. But trying to mimic that walking around and just listening and learning and see if there's ways that make sense given your work culture.
Colleen, anything to add before we go to the next question?
No, I would agree. The surveys that we have heard of corporations doing are really letting them understand the needs of their workforce. And also, you know, to a point we haven't really brought up much, but some of the conversation is going around even the remote workforce. It may also show skills gaps that you have within your workforce. So that's helping people rehire and retrain some of their workforce on some of the skills gaps they may need. If this is their new normal, that they're going to be continuing to be in a hybrid or an online work environment.
So we have a question in the chat from Susan Zalisco, and she's curious how to think about this dynamic of vaccinated and unvaccinated and how you might approach the requirements and other potential, issues that are coming up as workplaces think about, so to speak, the vaccine passport for the workplace. And not to put you on the spot, Dean Murano, but I mean, I'm curious to start with you, maybe from a public health standpoint, and then don't laugh too hard, Dr. Rama, because we're coming to you next from a human resources standpoint.
Okay, so the question is how to just manage through this very mixed population of people that might be your workforce. Is that
and whether or not you have policies that either encourage or require the vaccination.
Right. This is $1 million question, right? And our own organization is struggling with it. There is no right or wrong answer. This is the intersection in public health policy between not just the science, but the social will and the political will. So depending upon social cultural norms of your work site, as well as what political kind of setting you're in and norms, We know that every state has different regulations of how they look at vaccination policy, period, not just COVID. How easy it is to opt out versus opt in, expectations of students, expectations of employee vaccination. We were discussing it ourselves at our university. If you work in a healthcare setting, it's normal to be required to have flu vaccines. So being required to have a COVID vaccine is like, well, of course, this is worse than the flu. Of course I should do that. But that's not the case if you're in different settings. So I think maybe be attuned that where you're working might have different norms and expectations. And this would be another great opportunity to listen to your workforce advisory around that. And what you can and can't do in terms of pushing on it. And then there's lots of creative ways people have been trying to incentivize it in a way that's still voluntary versus mandatory. We see nationally that there's a lot of people don't like in the United States being told what they have to do. That's just a cultural norm by and large. And so people push back on that. There's a lot of creative, and I'll let others speak, but behavioral economics, nudging kinds of things. Ohio State, for example, ran a lottery as a way of, if big lottery. If you were vaccinated or had started vaccination by a certain date, you went into a pool. Colorado is now doing that as well. There are a lot of things, it's multifactorial. There is not a single bullet that's going to get everyone vaccinated, but also recognizing we don't have to have everyone vaccinated. So for some, there will be reasons why they are not, and we need to honor that as well. And so what we're trying to do is just shift the curve, I think, so that we get enough folks protecting one another that it helps us be safe as a community, not just as individuals.
Great, thank you, Dean Murado. And Dr. Varma, we'll come to you from a kind of HR perspective and how some of our companies are thinking about these issues inside of those HR departments.
Sure, thanks, Seth. To start with, I think organizations need to recognize both the C-suite as well as the HR folks. We don't have all the answers. So we don't need to act like we don't. Let's acknowledge this is an evolving concept. This is an evolving pandemic. Even Dr. Fauci is very honest to say, I don't know, I'm learning, and even CDC keeps changing guidelines. This is very important. Rather than we figured this out, everybody needs to be vaccinated or you're out of here. And not so fast, number one. Number two, be attuned, as Dean Murado said. That is very critical. Don't shut yourself off. Okay, now let's get back to work. Let's see what's going on around us, around the world. Call on experts, legal experts, health experts, listen to CDC, listen to the mayor, everybody. And then let's wait and watch. And finally, something that we often forget, we get into this categorization. It's a blue state versus a red state. A blue state isn't all blue. It made it blue because 51% of those that actually voted blue or red. There's red people next to us and blue people next to us. So in the workplace, there will be people with different political affiliations, different X, Y, Z. We need to bring everybody along. We can't decide, well, you're not with the programs. No. And we're talking about India and Malaysia. Within the US, companies that are operating in Chicago and in Texas and Mississippi will have different experiences. So let's learn. There are no ready answers as of yet or ever. Thanks.
Given our work as a center in social responsibility in business, I'll just add one point to what Dean Murado and Dr. Varma have shared. That is, increasingly, companies are showing their commitment to responsibility by giving paid time off, both for getting the shot, as well as if there is a reaction to the shot, so that employees don't have to worry about getting a second shot and then missing the income of a day of work if they end up getting sick. And so that has certainly encouraged a lot of people and made it more accessible. And specifically, it's begun to help to deal with some of the inequities that Dean Murado talked about, because the people who are at the highest risk are often those with the least discretion in being able to make those choices without employer involvement and support. So that's another way that I know a lot of companies are approaching it, not necessarily requiring it, but creating the conditions under which people can pursue it successfully themselves. We have another question here in the chat from Sandra Cavallari, and Sandra, I'm going to come to you to ask it.
So yeah, you were talking about the surveys, and I actually was talking and thinking about doing that because we are in the process of trying to figure out how to have staff return, what's fair. So what we do is we're at the medical school, and my staff basically they coordinate all of the medical school courses. So we've been doing this remotely, obviously for 15, 16 months, whatever. But now, in-person classes are starting. And for some classes, some clerkships, their presence is needed more than others. So the ones who can probably, stay home altogether, it may be viewed as unfair to the others who will have to come in. So, what is fair? And so that kind of a thing. It is an expectation of the job. It's in the job description. This is kind of what they signed up for. But on the other hand, I'd like to kind of get their sense and not, as Dr. Varma said, not be the dictator and say, this is what it is. And if you like it, fine. And if you don't, find yourself another job. That would be pretty horrible for the medical students, because then no one would be coordinating everything again. But yeah, I would just like to go about it the best way I can. And you were talking about a survey, and I was thinking of it, and I thought, but okay, what questions do I ask? How do I ask them? What is, from an HR standpoint, the correct way to ask questions? Keep it anonymous, obviously, but if, you have any templates that I can steal, that would be great.
Great, thank you, Sandra. And so maybe we can go round robin here and just hear, what's one or two questions that you would recommend beyond that list so that, there can really be that effective feedback loop. Colleen, it looks like you've unmuted. Get us started.
Sure. So Sandra, great question. Most of the corporations that we're talking with, they have first consulted HR, first of all, to make sure that they are asking questions that are fair questions to ask. And it's the way you're crafting the question might be, how has your work changed and life balance changed since COVID, where you can leave them open-ended to gather more feedback instead of, directly saying, do you have children at home, or is your life better without a commute? I mean, there's probably a million ways not to do it, but some of the open-ended questions may give you some more feedback. That would be my recommendation. But Dr. Varma, I'll pass that to you.
I just want to add a couple of things here to Sandra's question. The first thing is, what should we do? I'm going to borrow a phrase or paraphrase my friends in the real estate business. Communicate, communicate, communicate. Over communicate. People need to know what's going on. And if you, meaning the leaders, don't know, acknowledge that. Saying we're waiting, we're watching, we're learning. That's one thing that my employer, Loyola, did very well in the last 1 year. Sometimes overdid it, so many of us just skimmed through and then realized, oh, it said if you read this carefully, there's $10 on your door. So miss them. Communicate. People need to know. And there's no reason to act like we know everything. As far as the questions are concerned, at this stage, we really should be asking questions about feelings, emotions, fears, not about what your children are doing, or do you realize you might lose your job? That's not the kind of question we want to ask. We want to understand and recognize people are scared. People have had losses. People might be excited to come back. Let's talk about emotions. And actually, when we do that from an HR perspective, we know people really get connected to the organization.
May I build on that, Dr. Varma? I would suspect then, from what I read, if we do, this is an opportunity, right? If we do this well, we could end up with a more engaged, more collective organization that actually is better for the bottom line and people line as we move forward, right? From an HR, is that right?
Absolutely, you've hit the nail on the head. The benefit is long-term, loyalty, engagement, commitment, because people believe the organization sees me as a human being and as me by name, not, oh, the male employee of our company or the Asian, me. beautiful opportunity if we do it right. Thank you.
We have one final question that I want to get to with our remaining 4 minutes. Molly Claiborne, you have our final question here.
Hi, thank you. Yeah, so I was just curious if you have any advice for how to get buy-in from employees to start returning to work in a hybrid environment when the work has been done successfully remotely 100% for the past year plus. But there are values and benefits to being back in person. But I mean, the nature of the work has allowed them to be successful from home for so long.
Yeah, there is a interesting dance taking place because over the last year, people have shared their pride that their workplaces responded wonderfully to the online moment and were able to keep doing their work at the same level of productivity. And after celebrating that for a year, right now, many are saying, well, we should have to come back. And this question of, what's the case for that? How do you convey that and begin building buy-in? And so I'm eager. Dean Murata, you look ready to begin answering.
I'll share something just from my own personal work experience. I hope the HR experts here maybe can corroborate it. I used to, before I was academic, I used to work for a global product development company, and I ran global teams. And that was a version of working remotely. And as I worked with my organizational HR experts, they advised me that to have good team management means you have to make that inhuman connection so often. So while this could be a very high functioning team, if I did not build in connectivity and bringing folks together in a intentional or disciplined way, it all starts to evolve, devolve. And so I wonder if some of those lessons learned from folks that have done global product development or any workforce could be applied to us as well. And then that leads you to think about, well, what's enough? How do you organize it? Is it a cohort? Is it, it gets us thinking creatively around that. But we're humans, and for most work, if we don't connect, we lose commitment to a shared vision easily.
Thanks, Dean Murata. Yeah, we're going to take the 30-second answer from everyone else as well to make sure we get to everyone before we finish. Dr. Varma, you're next.
I'll do 12 seconds. One, two, no. So number one, it's not going to happen overnight. The event happened overnight. Bringing everybody back is going to be a process. So be patient. Number two, as people start to come back, celebrate the benefits of why you're bringing them back. So as Dean Murata said, we talk about building community. On a regular basis, let's share. Now that we're all back, see what happens. So when people see the benefits of coming back, they'll be happy to come back. If they think it was just an excuse or a ruse, we're going to have trouble. Done.
Thank you, Dr. Varma. Colleen?
Yeah, I would just build on what Dr. Varma just said. One of the big key benefits is those interpersonal relationships and those outlets for creativity. So make sure you're highlighting that to your team, is that those synergies, those organic synergies are happening while we're face-to-face more frequently than they are happening in a virtual environment. And then what we have seen some companies do is they are allowing people to choose which days they are there. They're saying 2 days home, 3 days in person, and then just making sure that the schedule has coverage so that your teams can collaborate together on choosing those days that work best for everybody.
Laura, our final word.
Well, I can speak personally for the way that we're operating at Chill for our own team, which is I've just asked a couple people, would they like to have a once a week meeting in person? How would that make you feel? The weather's nice. Would you prefer to do it someplace outside? Would you prefer to do it someplace inside? So I'm asking first and then handling this with baby steps.
Well, this has been a phenomenal panel that has really covered everything from public health to the business strategy to our mental wellness. And we have been so wonderfully aided by the four of you in this journey. And thank you all for being here with us. This has been awesome to have you virtually. And we look forward to continuing the conversation. And I will say in the next academic year, because this is our finale for this academic year, there will be an opportunity for you to rejoin us as a center in person. So when we get there, we will think about all the ways to build your buy-in and excitement. And my colleague, Emily, who will then be interim director, I know is excited for that. So thank you all. Have a wonderful rest of your days. Yeah, namaste.